Morning.
I'm good, thank you.
Good.
Quite
Uh,
looking forward to it.
okay, great. That's what I like to hear. Yeah, so first of all, just to give people some context to this, Susan, you emailed me the other day from the email I sent that, interesting doing a demo. Then we had a phone call, I think it was for about 10, 15 minutes. I did a
Mm.
bit of a brief history intake with you, and we very quickly got to some possible Emily's, you could say, some of the
We did.
maybe causes. And I felt you were somewhat maybe a little bit surprised. Like a couple of things came to you from the questions I was asking you.
Mm.
We hit upon at least one, if not maybe a couple of things. But before we even touch on that, can you just tell me what the presenting problem is and just share with everyone what is the issue and give us some background, Susan, on the problem or the
Yeah.
issue?
So, 2 years ago, um, I was diagnosed with cancer,
Yeah.
an incurable cancer. So, not a good diagnosis. And it's been a very tough journey up to this year. I'm doing a lot better now and on a new targeted treatment. And it feels somewhat like it's a lifetime ago last year. And I think I've parked it right over there. But very quickly yesterday, working with Stephen, it was right there. And
Yeah.
yeah, so that's what came up. Just that the journey that I've been on the last 2 years that's produced an anxiety that I didn't have before.
Yeah,
Um,
sure, and sure. Yeah, so thanks for sharing that. Like I say, you've been through a lot there, only in the last year or so with that diagnosis. I think in the email as well, you initially mentioned you were having some symptoms.
yes,
Can you just talk about in the email you sent me? What were because that was the thing you wanted to work on. Yeah, it was around the
yes,
anxiety and I think it was feeling, I think you said in your teeth or your gums
yeah,
or,
yeah, yeah. So the symptoms, it started after um a procedure that I had. The symptoms are like pains in a discomfort under my chest, and then it goes to a pain in my chest. Then that affects my breathing, and it goes up to my jaw and my teeth, which are also signs of a heart attack. So when I've had this, I've had my heart checked, several times.
yeah.
Um, and then somebody said that it could, but my doctor said that it could be a spasm, esophagus spasm, like having cramp in your leg. It could be in my esophagus that's causing it. So prescribed diazepam, which I'm not keen on taking. Um, and it's just the slightest thing. I've had normal anxiety in the past like anybody else, but it's the slightest thing like raised voices or worrying about something that can produce this. I have noticed that if I use distraction techniques, that I can stop it going up, to my jaw, my
Yeah.
teeth, my sinuses. So I have been working on it myself as well.
Yeah, because you're a therapist,
Yeah.
so that's the one of the benefits as therapists. We get to learn all the tools.
Yes. And breathing as
Yeah,
well. Yeah.
yeah. And that sensation you were feeling, just to confirm, the feeling under the chest going up to the mat, is it like a pain feeling or a tingling? What's this?
It starts as a discomfort just under my bust.
Hmm.
It starts as a discomfort and then it moves up to a pain in my chest. And then I feel like I can't breathe properly.
Okay.
And then I feel it in my teeth first, actually. It goes up to my teeth and then
What's
all
the
my
what's the
jaw.
actual feeling or sensation in the teeth? Is it tightness or
Like,
is it pain or is it
no, it's an ache.
an ache?
Yeah, an ache. Yeah, it goes up
Okay.
to my teeth and it's like an ache, but in every tooth. Like toothache in every tooth.
Okay. Right. And when you're feeling it here as well, is it still radiating up from the chest? Like, are you
Yeah.
still feeling from here all the way up at the same time?
Yeah. And
Okay.
if anybody's with me, I can't bear them talking to me. I can't bear them talking to me. I have to be left alone, to try and deal with it.
Okay. So it's so uncomfortable.
Yeah,
It's like it's consuming.
yeah,
Okay. Okay. Thanks for sharing. Um, so yeah, this was the presentation, and then on our call, I did a bit of a history intake. So I was asking you the obvious questions. I call them obvious.
yeah,
Obviously, what's the problem? This is the problem. How long has the problem been there? Then you walked me through, as you said, the last year or so, what you've went
yeah,
through with the diagnosis. I did a bit more digging. I asked some other
yeah,
questions about what happened maybe before. Was there
yeah,
any specific events? I was asking, was there an event that you feel like caused it, or what possibly is causing this, or when did it start? And then you shared with me there was a couple of events. You were giving me a bit of history on a few different stressors that were, causing very possibly that more vulnerable landscape. But there was an event you mentioned that there was a couple, but there was one that you kind of like had a realization. Could you just
yes.
talk us about what may have caused this, or one of those distressing or traumatic events possibly?
Well, the event was a procedure that I'd had quite a few times, and found it quite comfortable. I couldn't see it. I think that made a difference because it was like from the rear. And but this particular time, it was more intense because I was having a drain fitted, and it was another person that did it, and a registrar, and she didn't do it right anyway, and it was very painful. And I very quickly began to sweat, have palpitations. I felt like faint. I was going to pass out, and that came up while I was talking to Stephen yesterday.
Yeah, when we were, asking those probing questions. And was this event in a hospital or a doctor's clinic?
It was in a hospital, and the fear was that she'd punctured my lung, and the fear was uh, that it could be fatal.
Right, were you lying down at
No,
that time?
I was sat up. I was sat up
Yeah.
with my arms over a trolley in front of me because they were working behind going into my lung.
Okay. So we have an event, right? Let's look at the Emily. We have an event. The meaning of the event, where's the threat? You thought maybe your lung is punctured. That's your amygdala, the threat level is like, yeah, it's 0 to 90, literally. You thought something had went wrong.
Yeah,
Yeah, yeah. And the fear kicked in,
yeah,
or the panic. Yeah, I can see it's distressing you, as we're even talking about. That's your amygdala activating. Then it's inescapable as well. You're kind of trapped in that situation. You're kind of caught. This thing's happening, and this has happened, and there's an inescapability around it. And you've already been through a lot even before then. So
yeah,
the landscape is permissive. So there's an Emily right there, and you can already see the stress. Because you're feeling distressed and because you're getting triggered, we're going to begin the havening, if that's okay with you, Susan.
yeah, that's fine.
So let's begin. So what I'd like you to do is close your eyes, please, and just recall that distressing memory and event when you're in the hospital, when you're getting that procedure done. Picture what you saw as if you're back there right now. And that feeling, and that person working on you, and you feel it's gone, it's going wrong. Something's gone wrong. Picture what you saw. Remember what you heard, what you thought, what you perceived, what was happening. Go to the very worst part of the event. Really picture it. On a scale of 0 to 10, how uncomfortable do you feel?
9.
Do you feel it in your body anywhere? Your chest, your head, your stomach?
No.
It's just the emotional charge is up at the 9. Open
Yeah.
up your eyes, look at me. Clear your mind, please, Susan. Let's begin stroking down the arms, please. Now, are you okay with imagining walking on a beach or through a park? Where's a favorite area you like to go for a walk? Or
Oh,
somewhere
definitely the beach.
you love the beach. Okay, let's do the beach. So I'd like you to close your eyes and imagine walking out onto the beach on a bright summer's day. And just imagine what you see, maybe the sunlight sparkling off the ocean waves. The sound of the waves lapping in. That feeling of walking on the sand or the promenades. And the smell of the fresh sea air. Maybe it's a lovely bright blue sky. And you can feel the energy of the sea. And as you imagine walking along this beautiful beach on a lovely day, count out loud from 1 to 20 at every step you imagine taking. Starting at 1.
2,
That's it.
3, 4, 5, 6,
Relaxing with every step.
7, 8, 9, 10,
Even imagine a few seagulls flying by in the
11,
distance.
12, 13, 14,
Very good.
15, 16, 17, 18, 19, 20.
Now as you keep stroking, I'd like you to sing Row Your Boat with me for the fun of it. Okay? Let's go. Row, row, row your boat gently down
the
the
stream.
stream. Merrily, 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 life is but a dream. Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. Then we can hum it. Do, 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 do. Diddle, 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 diddle. Do, 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 do. That's it. Keep stroking. I'd like you to open up your eyes and just look at the top of my pen. Keep stroking. Just keep stroking gently, Susan. Then keeping your head still, move your eyes laterally to the right-hand side of your room, all the way over. So all the way over, yeah, then to the left. Look downwards a little bit more. That's it, then to the right. That's it, down to the left. Gently to the right. And to the left. And 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 we'll do one more to the right. To the left. Then I'd like you to gently close your eyes all the way down. Keep stroking. And take in a slow, gentle breath. That's it. Focusing on that soft, sensory touch. Nice and easy. And without thinking of anything, on a scale of 10 to 0, what number comes to mind now? How do you feel?
2.
Very good. Then I'd like to invite you to move to the palms, please, Susan. So you can look at me if you wish. And we'll just do some gentle palm havening. That's it. Nice and easy. So whatever feels most comfortable,
Hands
soft and gentle.
clammy.
Or would you prefer to do the face? For face or palm? Are you happy with the palms?
Yeah, yeah, yeah.
Okay. Then I'd like you to close your eyes. And then this time we'll count backwards together from 30 down to 0 in twos loud. So going to do a cognitive distraction. I really want you to picture the numbers in your mind if you can, and maybe some colors in them. Starting at 30,
30,
28,
29.
26. We're going to go in twos just to
Oh,
make
sorry, sorry,
make it
sorry.
a wee bit more trickier for us. So we'll start at 30, 28.
26,
That's it.
24, 22, 20, 18,
That's it.
16, 14,
Relaxing with every number.
12,
12
10,
and
8, 6, 4, 2, and 1. Oh, no.
excellent. Yeah, that's great. Then we'll sing Twinkle Star together if you're okay with Twinkle Star. And let's go Twinkle, twinkle, little
Little
star.
star, how
How I wonder
wonder,
what you are. Up
up
above,
above the sky so high, like
like
a
a
diamond
diamond in the
in the
sky. Do, do,
twinkle,
do, do,
twinkle,
do,
little
do.
star, how I
Mm-hmm,
wonder
mm-hmm,
what you
mm-hmm.
are.
Up above
Above
the
the
world
sky
so
so
high.
high, like
Mm-hmm,
a diamond in the
mm-hmm,
sky.
mm-hmm.
Mm-hmm.
Mm-hmm, 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 mm. Very good. And then you can open your eyes, keep stroking. Then you can look at my finger gently. I'll just gently again move the eyes laterally to the right and to the left and to the right and to the left and to the right and to the left. Now we're just going to gently close the eyes, Susan, keep stroking and take in a slow, gentle breath. Focusing on that soft sensory touch. And without thinking of anything, on a scale of 10 to 0, where do you feel right now?
0.
Okay, very good. And I like the little smile that came across your face when you said that. Okay. Yeah, we'll just keep doing the touch. So what I'd like you to do now is you can gently open up your eyes, take a little stretch if you wish. Maybe a drink of water if you want, it's up to you. So we'll do a debrief in a moment, but before we do, let's just generally tune into how you're feeling right now, kind of energetically or in your mind, your body, your felt sense. How are you feeling right now?
Relaxed. Relaxed, yeah. I could
Good.
feel it more. As I use my palms more, as opposed to just my fingers. I think I was using just my fingers. And as I use my palms more, I felt all my body just relax more.
Okay, that's a good distinction. Yeah,
Mm.
it's usually the palms going
Yeah,
back. That's why at the start I got just to alternate it, kind of play. Yeah, notice what
yeah,
feels right. Some people like more fingertipsy. Some people it's like they like a deeper,
yeah.
long stroke. And
Mm,
once again, there's all these receptors in the skin, and we're activating them. But you're also activating them in your palm as well. That's the thing you're getting that
mm.
simultaneously on the palm and the arms. Okay, nice. So you're generally feeling much more relaxed in your mind
Yeah,
body.
absolutely. Yeah, I am.
Okay,
Yeah.
great. So we're going to do then our clinical, I call it a clinical debrief, where we're going to check a few things based on the procedure or work we've just done. So let's check that memory again. So I'd like you to close your eyes when you're ready, please. Take your time. And when you're ready, go back to that memory again that we started on. Let's just see what the differences are now when you picture it and how you feel. And once again, there's no right or wrong answers. We're just debriefing, checking, and just seeing what differences are possibly there.
Okay. No, it's just not conjuring any. I'm going through it. You know, the image of it all. It's just not conjuring that same emotional.
Yeah.
Thank you.
Right. Yeah, you're actually smiling and laughing now, while
Yeah.
7 minutes before you were visibly upset. You were abreacting,
Thank
and
you.
the emotional charge was coming right up. Yeah, so as we say, a huge difference in your body language, your expression.
Yeah.
Yeah, as I say, there was even a little smile in your face when you went zero, which was nice. Very important to watch clients when you're working with them as well, because their body language and expression, just energetically, you'll see a lot of things happening. Okay, good. By the way, is the memory changed in any way? Like when you close your eyes, like sometimes the memory might change as again, sometimes it seems more distant or further away. Some people it's harder to actually access it. It's like they know it happened, but you just can't conjure the kind of the imagery or the sounds. Other people see more the peripheral information. It's like the whole
Yeah.
memory opens up.
I could get the image up exactly the same,
Mm,
but it wasn't charged.
yeah.
There was no charge of emotion at all, other than it was a procedure that I'd had several times. So yeah. Oh, wonderful.
Brilliant. Okay. And let's just check. Just close your eyes one more time. And when you think of that memory again, where are you feeling on the scale now from 10 to 0?
Zero. Zero.
0.
Mm,
Excellent.
yeah.
Okay, you can open up your eyes. Yeah. Well, congratulations. Well done, and thank you for doing the demonstration.
You're welcome. Thank you.
So by the way, Susan, do you have any questions or anything you'd like to ask me at this point? Considering you just did the demo, I always, just in case you have uh, any questions. Is there anything you'll ask me? Maybe not. Maybe you just want to relax a moment or two.
Yeah. Yeah, I'll just relax. I'm sure
Just
I will have
chill.
questions.
Just chill. Well, I just want to say to you, yeah, thank you for coming forward to the demo. It always takes a certain amount of courage and bravery to come on to training and volunteer as a demo. So I appreciate that, and thank you.
Thank you. And
Well,
I apologize for my singing.
oh well, look, I think one of us could apologize for that, but it's a bit of fun. That's the thing. It's
Yeah,
a
you did.
fun. Sometimes when it's bad, it's funny. That's the thing. Uh, so, I'll check in later. We'll check in later as well over the
Yeah.
weekend. How you feeling, and some of the other stuff that you mentioned to me on the phone. You could work on some of that if you want in the thing, and kind of do a big, clear out if you like, on other stuff.
Yeah.
Okay.
Thank
Thanks,
you
Susan.
very much.
Thank you. Okay, so what you're seeing there, everyone, that was I suppose, a classic demonstration of how event havening